The Public Health Emergency Preparedness, Response and Recovery Fellowship Program has graduated its first cohort after completing an intensive 8-month hybrid training. The fellowship was collaboratively developed and implemented by Center for Global Health Practice, Georgetown University, and the Emergency Response and Capacity Team in the Division of Global Health Protection at the U.S. Centers for Disease Control and Prevention. At the graduation ceremony on Friday in Abuja, speakers including Assistant Professor Ibrahim Gobir, Coordinating Minister of Health Professor Muhammad Ali Pate, represented by Dr. Ngozi Osu, and US CDC Senior Regional Advisor Kirtan Victory, highlighted the fellowship's impact in addressing workforce gaps and enhancing regional emergency response systems.
With the ecosystem mapping, it's also something that shapes how we started looking at PHEPRR. Who are these other stakeholders that are equally important in public health preparedness, response as well as recovery, that we are not carrying along? Okay? And if you just take a look at this, you can see even for Lambda fever alone, we have a whole bunch of actors being involved. We did something similar for PHEPRR, even though I don't have it here, but that's just supposed to put things in perspective for us. Whenever you think of any public health event, you have to be able to do that mapping, and you have to be able to carry all of the stakeholders along to prepare and potentially being able to respond.
The importance of having experts in emergency preparedness and response cannot be overemphasized. Bearing in mind the massive emergencies in our various countries, including Nigeria. Emergencies in health, like all the outbreaks that we know, the diphtheria of this world, the cholera, the Lassa fever, the monkeypox, even the polio, which, well, we have contended with the wild virus, then we are still having the circulating variant polio virus in Nigeria and also across so many of the African countries. And of course, not to belittle the other emergencies like the flooding that we had in Maiduguri. We had to be in Maiduguri, and even the tallest buildings and the bridges were actually swallowed up by flood. So the importance of having you trained as emergency responders cannot be overemphasized.
In addition to trained FETP, in addition to trained fellows, we needed to build surge capacity, where we needed public health trained people to respond to emergencies, because we felt like sometimes during emergencies we don't have enough personnel to respond. So this is where the Public Health Emergency Preparedness and Response Fellowship started by our team in Atlanta. And basically it's a bridge between what FETP does and what FED does. The program provides like for example, people who don't have like a lot of significant skills in epidemiology and public health. You train them so that you have such capacity to be able to respond to an outbreak.
And then over the 6 months, we will continue to, mentor you guys. You are available to reach out to us in case you want us to support you. We hope at least you will be able to apply all of the things that you've learned and be advocates and leaders in your respective fields to be able to actually strengthen the public health in not just your country, but even in the region.
Fellows from 5 West African countries pledged to use the training to advance public health resilience and preparedness.
Before I start, I'm standing here on behalf of the 6 fellows from the 5 countries that are participating in this program. First of all, we want to say a very big thank you to the Almighty God, who has made this day possible. Indeed, this 8 months journey have been fought with a lot of challenges right from the beginning till now. And indeed, today is a day for us to actually say thanks to the Almighty Allah for making it possible. And that's, we want to start with that appreciation. Also, we'd like to express our gratitude to Georgetown University, CDC, all the other partners, the Federal Republic of Nigeria, for hosting us and for making sure that this program actually solved your life. Like we heard from the program head, this issue started more than 2 years. Indeed, it started when some of us were not aware something like this was happening. And today is a day for us to see the first cohort being graduated. And for that, we want to say we are very, 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 very grateful to you for giving us that opportunity. Some of us never thought we would get a stage like this. But for the fairness and the manner in which this program was, rolled out, gave most of us the opportunity to stand here today. And for that, we'll forever remain grateful to you and for what you are giving to us.
After going through this fellowship program for the last 8 months, I think we are definitely certain that there is a roadmap and there is a guidance that we can implement and expand to have more potential public health responders trained and ready to work, especially where they work on a day-to-day basis. As had been highlighted in the initial goal for the fellowship itself, we're seeking to be able to build the capacities of as many people who are potential responders where they currently work, not necessarily that we all have to go to the emergency operations center to respond, or that we have to leave our offices or stop working to actually get our jobs done. So we're looking at not just public health or healthcare workers, but anyone who is likely going to be able to add value and contribute to either the prevention or the early response for any public health event, to actually have them on board for these processes. After now, I do believe that another cohort for West Africa will be launched in the next few months. In addition, the fellowship is also going to be replicated in Asia and some parts of Southern Africa.
You find that in the health sector, we talk more about that because the impact is a lot more, because it has to do with life. It has to do with saving life. It has to do with providing services for the Nigerian people. And I want to underscore the fact that it is also not peculiar to Nigeria. You also have people, human resources, leaving different countries to places where they believe that they have greener pastures. The federal government of Nigeria has actually worked on what we call the migration policy, where the conditions of service for particularly health workers has been improved in terms of providing infrastructure for some health workers, especially for those people working in underserved areas and communities. Training opportunities also being provided for them, and their capacity building. And the government is working on also improving the conditions of service with respect to the financial bit. So that is what is being done. And then I will plead with particularly health workers in Nigeria to have patience for the government, because there are plans to make sure that the service, the conditions of service, the retention policy, etc., are improved to make sure that they are happier.
8 months is not a joke for both the facilitators as well as the participants, because it entails a lot of sacrifice. And with the kind of sacrifice that all the participants as well as the facilitators put into the fellowship itself, where you have to learn everything around public health emergency preparedness, response and recovery, we will expect that when they go back, they are able to first and foremost use the knowledge that they gain to actually put that into practice. That's one. Putting it into practice in terms of in their jobs, and then most importantly also being able to build the capacities of their colleagues within the space, because we don't have this kind of fellowship out there for the non-EOC actors. So we'll expect that they will be our advocates. They will be those, they will be the ones that can go out there and start to build the capacities of others to actually know what to do, when to prepare for an event, and potentially being able to prevent and respond to an event.
University, I am happy to present this certificate of completion to Dr.
Neil Weha. Congratulations.
Your response